Thank you. I'm really honored to be with all of you today as well. While I am a physician, I am a cancer survivor first and foremost, and was asked to talk today as a young cancer survivor. I was diagnosed at 41, and my talk will talk more about that. So my title today is New and Improved. I really feel as much as no one wants this diagnosis, we all have had silver linings because of the diagnosis. We have met great people, some in this room, and have been given some amazing resources, just like the talk that Jennifer had. I learned a lot, even as a physician doing menopause care. But again, just wanted to introduce myself and move on, feeling new and improved. So as Jennifer mentioned, there are currently 18.6 million cancer survivors for all cancers in the United States. By 2035, that number is going to be higher than 22 million. The good news is 70% of people, cancer survivors, are living greater than 5 years, which is an incredible stat that hopefully we all will continue to fall into. But those numbers are huge. And as we continue with more immunotherapies and accelerated new technology and treatment, this is just something, these conferences, survivorship care is really near and dear to me. When I was diagnosed in 2010, there wasn't a lot of this. As I said, I was an old mom. My youngest was 2 and a boy, you'll see some pictures. And we had 2 daughters as well, 6 and 8. I got diagnosed the last day of 3rd grade and kindergarten for our girls, and then daycare for our son. Looking first at young breast cancer survivors stats, and this was sort of an aha, I hadn't had this in previous talks. Seeing these numbers and recognizing, more, and this is from the CDC, so this is regarding US breast cancer survivors, knowing that, 13,000 to 33,000, depending on what age you recognize as young, I think under 45 and younger, that there's 33,000 a year diagnosed at this younger age. And looking at you and looking out into the room, I can tell that many of you have fallen into this number, as I have. I was astounded to realize that it's the most common form of cancer in women who are pregnant, or in my case, which again, it was surprising, that 30% of all breast cancer in women is diagnosed just a few years after a woman has had a baby. And again, my cancer diagnosis was my very first mammogram. I was 41 and I had breastfed for a year, and then my doctor said, give it a few months until you can get the screening mammogram, and lo and behold, there it was. The incidence too, speaking of metastatic breast cancer, is rising. And to me, that's a scary thing for women under the age of 40. We are getting better with our high-risk breast cancer screening, but as many of you know, the initial standard, screening recommendations begin at age 40, and that doesn't reflect this number that continues to rise for those of us that could have been diagnosed even earlier. This is my family, the one in the low corner with all of us. That was the day I got my head shaved, and we took a picture out in the backyard. The others, where I had my full head of dark hair, this is my after chemo gray, I was diagnosed June 6th. I had surgery bilateral mastectomy July 6th, and then my first chemo end of August. We went to the state fair that day, feeling a little amped up on prednisone and whatnot. And then, as you all know, and then 3 weeks later, started to lose my hair. And again, it was fun for me to look at these photos. I hadn't found them in a while, or included these particular ones in previous talks, and really hit me a little bit like, wow, yeah, our kids were really, really, really little. These two, just some more photos to make it real. again, I was working full time at that time. I continued to work full time with great colleagues. But as we'll talk about with some lifestyle medicine things, you can see in the middle photo, we were at the Minnesota Arboretum. And I looked like a twin to my husband, which was crazy. We still laugh about that photo. I did not wear a wig. You can see in the last bottom corner, I went wig shopping with my older sister, and our son was so scared of the wig. He saw it one day on the headstand, like day 2 of me having it, and he just freaked. And so I just walked around and went to work with a pink breast cancer baseball cap, or was without any hair when I was at home. But this was our family sort of getting through the fall of 2010. And trying to make the most of it. As we know, as young survivors, there are unique challenges. And I really, really, really was touched when Princess Kate came out, or they came out as a family, and she asked for privacy and she asked for time to be out of the spotlight and really dedicate her energy on her kids, her husband, and whatever her needs were. She hasn't been very forthcoming, and nor does she need to be, about what type of cancer she actually had and went through treatment for. But ironically, her kids were almost the same ages as mine. She was 42 when she was diagnosed. As I said, I was 41. But my mom, who is 85, healthy and vibrant, called me and said, "Isn't it great that, Princess Kate is taking some time?" And I said, "Mom, do you realize that was me?" And she I think we all were just, deer in headlights, right? That she couldn't even believe that was us at 41 with 3 little kids. And so it was an interesting conversation, to say the least. But these are just a list. I don't need to read through them. We all know, and hopefully have been able to work through some of these challenges, from infertility to mental health concerns, sexual dysfunction. Raising small kids, for me, that was, I couldn't just stop and focus on myself. My oncologist said, "Take 6 months off." I said, 6 months off? My kids will think, what in the world is mom doing at home every day? Because they were used to the hustle and bustle that we shared as a 2 working parent household. But in hindsight, we just sent our youngest off to college this fall. And I finally feel that now I'm actually processing everything 15 years later, and it's crazy. But my focus was getting through and making sure my kids were okay and my household was okay. We will again talk more about these challenges, but I wanted to say, first and foremost, I know when I was diagnosed, I felt, people would ask, "Well, what did you do? Why'd you get cancer?" I mean, again, this was 2010. Things have definitely evolved a little bit more so. But I felt, and at that time, there weren't a lot of young cancer survivor groups either. But I remember feeling like, well, what did I do? Why did I get this? What happened? What could I have done differently? Yeah, I was a super healthy, live healthy. I don't smoke. I drink very minimally. Try to practice what I preach to my primary care patients, and yet here I am, with cancer, bald, going through chemotherapy. And I love this slide as a reminder that we all have a blueprint that we cannot change. If you think of a house foundation, that foundation is poured from the moment that we're conceived. And there are very little things you can do to break those walls and change the foundation. And that's what genetics is. The epigenetics, the other picture, is what we are able to do is change the paint on our walls, move the furniture around in our house. And those are the things that I was asked to talk about today, and just to present more information on that. So first and foremost, think of cancer as a weed. The job of our oncology team is to destroy the weed. As Jennifer was talking and people were asking, well, what if my oncologist doesn't want to talk about these, other symptoms that we're having now that the cancer has been contained or resolved for the time being, come talk to your primary care physicians, because this is what we do best. We want you to think of your body as a garden. Let the oncology team do their work, making sure we're cancer free. Then really focus on prevention and your body as your garden, and how can we tend to this garden and prevent recurrence. As we all can guess, looking at these three pictures, 80% of all premature deaths are due to the following three factors: smoking or alcohol drug risk, poor diet, and then that's my favorite position at home, on the sofa, feet up, lack of exercise, or not moving as much as we should. But ironically, and myself is included in this, very few of us have totally sufficient healthy behaviors. This is me pre-COVID. I finally lost the 25 pounds I had gained through my chemotherapy. Great that our breast cancer chemotherapy and prednisone causes weight gain, not weight loss for many of us. And then with the early menopause changes. But ironically, when you look, the fact that your BMI has to be less than 25, that's really hard. That's always been very hard for me. I don't think I've ever been at less than 25, maybe as a teenager, but only 40% have their BMI where it needs to be. Only a quarter of us consume 5 or more fruits and veggies daily, or achieve the regular physical activity that's recommended. And 3/4, thankfully, were non-smokers in this study, but less than 3% had all 4 behaviors with A+ check marks in it. And again, myself included. There is a newer form of medicine that has come out called lifestyle medicine. I got this training and board certification right during COVID, and then unfortunately couldn't put a lot into practice because it was all hands on deck. I was working primary care for Fairview and urgent care as well, and love talking about this, but sadly, we do not have enough time in the office, as you all know, to even ask these questions. Or feel like as patients, we can ask our clinicians, hey, what should I be doing differently to reduce my risk of cancer? So the pillars of lifestyle medicine are these 6: nutrition, physical activity, sleep, avoidance of tobacco and other risky substances, emotional wellness, and positive psychology. My favorite quote from the World Health Organization is really defining what health is. We all, at one point think of health as the lack of any illness. And that's not what health is. Health is truly a state of complete physical, mental, and emotional well-being. And if we can really focus on that and not just, okay, well, I'm cancer-free for the moment. No, how can I actually maintain my best health moving forward? We will all have a more beautiful garden. So the first one, nutrition. This could be as many of you know, this could be a 2-week conference, but I'm going to keep it simple and just go through the basics. The most highly recommended diet for cancer survivors, heart disease, those are the 2 biggest, are this whole foods, plant-based diet. And this really focuses on more of a vegetarian or vegan. And you don't have to go to that extreme as I saw in Jennifer's slide, like, well, what's the best diet? It's the one that you are going to maintain. It's not keto, it's not paleo. It's what can you do? What can you serve your family, your partner? What can everyone eat? And it's easy to get on the table after a busy day at work. But a reminder that food should be our medicine, and medicine should be our food. We have gotten so far away from how important nutrition is. I think it's getting better. I know my kids have gotten a lot more education as teenagers in high school about nutrition, but I got none in medical school, none in residency, none, post training. And this is huge. This is just, these are such important tips that we all need to hear and have repeated. So in a nutshell, the biggest things when you're looking at foods that you're consuming is trying to keep your immune system as healthy as possible. And by that, it's lowering inflammatory processes. So with regard to that, this is probably the easiest slide to just, take a little screenshot. Inflammatory foods, as we all know, are foods that contain white sugar. So anything that has sweetener, or you're making cookies, there's so many other options to not use white sugar. And those are the processed sugars, processed meats. If you can avoid deli meats, bologna, things like that, they all create increased inflammation, which then creates the cancer cells to be reactivated. And red meat in particular, I tried to be vegetarian, and I just feel better with a little bit of lean meat in my diet, but I don't eat red meat, having read many of the studies regarding it. And then yes to the antioxidant rich foods. I think we all are hearing now in TikTok and Instagram, what we should be eating. And again, if you just think sort of farm to table, anything you make at home, fresh fruits as we're munching an apple, those are the things. I was happy to see the snacks. They're all really healthy as we walked in. Those are the things, if you can sort of shop the perimeter of your grocery store, that's where all the fresh stuff is, and not get too much in the middle. Specifically, and this one is near and dear to me because I feel frustrated by it. Breast cancer is linked to a higher BMI. And I'm a firm believer, I'm also an obesity medicine physician at the VA for the women vets, that in breast cancer, because many of those treatments do cause us to gain a little bit of weight, that we should really be allowed immediately to have any of the weight reducing medication therapies available to us. And that, and again, it doesn't have to be oncology. It can be primary care or an obesity doc, but that we don't talk about enough. And now that we finally have resources available, knowing that that is a direct link for us for an increased risk of recurrence. I'm very passionate about that. And then again, increased risk for breast cancer is this meat intake. So eating more soy, fruits, and veggies have been known and proven again and again to decrease that risk. So just the little nutrition prescription for this pillar: eat a rainbow every day. Make your plate look beautiful and colorful. 5 fruits and veggies, whole grains, legumes, nuts and seeds. Try to reduce as much as possible the amount of white sugar you're using. Meat and dairy. Dairy is also considered inflammatory because it's an animal product from the cow. So other non-dairy milks are preferred over cow's milk from an inflammation perspective. Continue to boost your immunity and drink as much as you can as far as fluids go. That being said, though, I just want to comment that there are barriers. We know that in many neighborhoods, there are food deserts. Our prices have been going up and up and up as far as groceries go. It's hard to eat this way. And then in Minnesota, during the winter, we don't have as much access to some of the fresher fruits and veggies. Then there are also lobbyists who want us to believe that meat is, all there is to get your protein, or, milk is the best. A lot of mixed messages. And as I said, very limited training amongst your clinicians that you're looking for answers. These are just a couple of resources or free apps. Dr. Greger's Daily Dozen is something that you can track how many fruits and veggies. It's super easy to use. There's also little recipes that pop up. And then these others are just other apps, the Lose It app, MyFitnessPal, that many of you might already be using, just again to help understand we need good protein, we need healthy carbs, we need healthy fats, and it breaks it all down and makes it easy. Next pillar, this is, I've got some Dragon Divas here. This is a photo from someone from the team, I can't remember, but I was giving a talk about the ABCDs of cancer survivorship, and they came up to me after and said, you need E for exercise. And it was brilliant. I'm like, you're right, I do. When I was diagnosed in 2010, exercise was not part of the recommendation. It was sort of like rest, relax, take care of yourself, do what you need to do. And now, as we all know, it's no, get going, get moving. And the Dragon Divas were well ahead of those studies, and were also very instructional in helping show that exercise really makes a difference and really helps to reduce risk and risk of recurrence. So as we know, this just restates all of this, but breast cancer has a 25% decreased risk in those that are exercising. And it is not linear. It's not the more you exercise, the less risk. Even if you just exercise a little, you are going to get benefit. Again, this is just a study that I thought was interesting. Again, lower volumes of regular activity had the similar overall survival advantages as meeting or exceeding the guidelines. So even on those days, especially during active treatment, I know there were days, if I had to walk around the block or go pick up a kid and, bring a car seat back into the house, I was done. I was pooped. But just making that a part, and it doesn't have to be running on a treadmill. Simple walking can be enough, a little bit of stretching exercises, keep moving. The goal, but again, there's no goal. The goal for everyone, non-cancer, is 150 minutes a week of moderate intensity where you still can talk and hold a conversation. If you're doing high intensity where you can't hold that conversation, 75 minutes a week is considered a goal. And again, modify the activity to your ability and preference, and work with physical therapy if there's a challenge that arises. Barriers, as we know, deconditioning, neuropathy, side effects, lymphedema, fatigue. Next pillar is sleep, and how important sleep is, as we know. Again, some sleep stats. A third of our life is spent sleeping. And I know when I don't sleep more than a day or two of bad sleep, I'm crabby. I'm crabby by day 3, and you better let me get to bed and have a really good solid sleep. Sleep is so important for the recovery of our immune system, our brain health, our mental health, and our physical health. With regard to sleep health and cancer, why it is so important that we're sleeping. Melatonin, we think of melatonin as what causes our skin to tan or be darker or lighter than others. But that's melanin. Melatonin is what people will take to help them sleep, and it's a natural hormone that is made that helps with regulation and facilitation of sleep. If you're sleeping well, DNA can be repaired, histone remodeling, apoptosis, anti-cancer cytokines can be repairing. If you're not, you are going to have a dysregulation to your immune system and increased cancer stimulating cytokines, which then can increase your risk of recurrence. The most interesting thing to me, again, just because I've worked many different types of shifts, overnight and day and midday, is that anyone who works shift work really has sleep dysregulation and has been found to have an increased risk of a number of different cancers. So if you are a shift worker and your sleep is not good, all the more reason to be sure that you are communicating with your oncology team or primary care team to get that better regulated. Again, sleep, your bed should be for sleep and or sex only. Trying to get to sleep at a regular time with a regular wake up time, that's considered good sleep hygiene. Really important, especially in winter time in the Midwest. If you're really, really cold when you go to bed, you can't fall asleep until your hands and feet warm up. And that's just how your body needs to vasodilate. The blood flow needs to get down there, and then your body can sleep. And I never realized that. I was at a sleep conference and I'm like, oh, because my husband always wears socks and I think it's crazy. So now I wear socks and I go to sleep like that and I sleep really well, especially in the winter. And that is really a true thing. And that's why if you drink alcohol right before you go to bed, that will not allow for the vasodilatation, or salty foods, again, constrict, and it creates a longer time for that dilatation to occur and move into the hands and feet. The other thing too that I thought was interesting is if you are having a hard time falling asleep, not so much staying asleep, but falling asleep, it's really important, if you can, in the mid-afternoon light, that you go out and you even, like, that's usually when I try to walk my dog. I get home at 5:30, 6 o'clock, and thankfully now it's getting lighter, but I need that light because I'm in a building from 7 to 5:30, and if you've seen the VA, there's like next to no windows. I need that light to be able to go to bed at my regular time. And I didn't realize how much it was the late afternoon light that was really key to helping you sleep better and fall asleep faster in the evening. So just something to think about if you're struggling with that. And then again, I mean, easier said than done. Minimize worrying, planning, and ruminating, and minimize that stress, and turn off your phones. I mean, I'm culprit. I'm always looking, and if you can turn that off, about an hour before you go to bed, that blue light is also said to not be as effective for us. Then this one I'll go through quickly because we all know some of this. Tobacco, obviously not great. If you are struggling with smoking or vaping, please talk to us. There are so many different resources. Of course, we know that tobacco and vaping are known to increase cancer risk. Why is that important for breast cancer? Because the tobacco, while yes, we know that it's going to cause lung cancer, increased lung cancer risk, it also helps or reduces the efficacy of these cytokines and DNA repair when the tobacco is entering our system. Prevention is huge. Vaping, yes, we do not know what is in the liquid of the vaping cartridges. That is why we have, initially, I know when my kids were in middle school, 2016, 2015, middle schoolers were able to buy vape cartridges. And then finally people realized, like, well, that's probably some cancer-causing stuff in there. And then, I don't know, 2017, pre-COVID, they then put the restriction that it was for 18 and up because they recognized they were introducing kids unnecessarily and increasing cancer risk with that. And just so for smokers, a combination of counseling and medication is more important than either alone. And many insurances have these counseling folks that will call and check in and provide those counseling services. And of course, there's a few different medications available to help. Alcohol and cancer risk, as we all know, it's everyone. This one is hard because even social drinking, one glass is too much for breast cancer. 1 glass a day. There is no amount per the breast cancer regulatory groups that have designated alcohol as being safe. And that's hard. I mean, I think not having that, there are other studies that will show, oh, but in France and, other countries, they have a reduced risk of X, Y, and Z. It's hard to argue that alcohol, similar to tobacco, certainly influences carcinogens and increases risks of cancer. So healthy habits, try to quit smoking, vaping, ask for help, try to reduce alcohol intake as much as possible. Then the last couple are my favorite: stress management, emotional wellness. For the longest time, I mean, when people ask me, well, why did you get cancer? I said, I don't know, I'm stressed out, and I do. I'm a firm believer that stress has a major role in our busy lifestyles that we have in the United States compared to other countries where we're all working 40, 60, 80, 100 hours a week and have very little downtime. That's not recognized. Now I learned that maternity leave has finally been increased in the state of Minnesota. Well, my goodness, we were forcing our moms to go back to work after 6 weeks. I was lucky to have additional time that I could take. But when I look back and think, like, how did we do all of that? That stress in all different manifestations is really an important thing that we're starting to acknowledge and note that this is a huge pillar that we need more awareness and reduction of. 70% of office visits to my office are related to stress and lifestyle. And we know this. When we're stressed, I'm the first one. I'm like, give me some chocolate and I'm laying down. I'm not going to exercise today. And that does not allow for a healthy immune system. Why are we stressed as breast cancer survivors? My goodness. I mean, the list is long and it's real. There are early side effects, late effects of treatment. There's fear of recurrence. I'm 15 years out. I think about it all the time. I had a colon cancer scare 5 years ago, my first colonoscopy. I woke up and the doctor's in my face telling me I had a 5-centimeter polyp that they couldn't remove and that he thought it was cancer. I'm like, are you kidding me? I ended up with a colon resection a few weeks later, and thankfully it was the earliest stage, but then was off for 8 weeks to recover from a major abdominal surgery. These are the things we deal with, right? I was more worried when I got out of the colonoscopy suite. It was still COVID time, so my husband couldn't be there. And I walked down the stairs to the parking lot and he looks at me, like, aren't you happy it's over? And I'm like, oh, buddy, guess what? And to see his face again in the same way that it was 15 years ago when we went through this, I thought, I'm so sorry. We need to deal with this again. Wanting to be more appreciative of life. This is also something that, we all have good days and bad days with this. Sometimes I get so bogged down and busy, and then someone walks in my office and they have a recurrence. And I think, oh my God, I need to get back on track so that's not me again. Or in a support group or in, some email chains I'm on for support groups. But it has made me more appreciative too. I'm the mom who, my son graduated this spring and crying like, oh my God. But my goal when he was 2 was I was going to live to see him graduate. And only my family knew that. But it's finding ways that we can reduce our stress. All these other ones, again, relationship struggles, discriminated at work. I also had an unfortunate event. I did Cytoxan and Taxol, then started on tamoxifen. Again, I was working full time. Life was getting into a normal. My hair was starting to get the fuzz. and I started tamoxifen and I had a stroke. And it's a super rare side effect. It's like someone on birth control who gets a clot. And I had been on birth control, never had any issues with birth control. But sadly, on tamoxifen, I was at work and it went to my memory center. And I'm at work, I'm about to go pick up my kids, which is what I always did on that part on Tuesdays. And I couldn't remember what time to pick up my kids. And so I called my husband, and thank God he was home because he was one of those business travelers who left Sunday night, came home on Thursday morning. And I called him and I said, "What time do the kids need to be picked up?" And he said, "Katie, what's wrong with you?" I said, "I don't know. I think it's a sinus infection. Like I'm just feeling funny." And I was able to pick up our kids, bring them home. He met me immediately at home. And then we called the ambulance to bring me to the hospital because I didn't want him to have to bring 3 kids and the mom to the hospital. Lo and behold, they thought I was crazy in the ER at the old St. Joe's that has since closed. And lo and behold, went through the scans and then, had the whole stroke alert and all of that. I was in the hospital for a week because no one would believe that a 41-year-old could have a stroke from tamoxifen. It was crazy. And so I had to go through a spinal tap. I had a terrible spinal headache after, an EEG, all this crazy stuff. And then finally I was like, "You need to release me. Like if something gets worse, I'll come back to you." But my stroke kept evolving on the imaging. So they kept me there. And then I said, "Enough is enough. Like I'm 10 minutes away." A few months later, I ended up going to Mayo just simply for an executive physical that my husband's insurance had an option to do. And the woman I got was had been in the cancer group at Mayo. And she goes, "Of course, that was from tamoxifen." But that changed the course for me. Of everything and my further treatments. But the crazy thing about work was I was like day 3 in the hospital, and my HR person calls me and says, "How long are you going to be in?" And I thought, "How dare you? Are you kidding?" But again, this is 2010, 2011. And that was crazy. Now in hindsight, I would hope that would not happen to any of us in 2026. But that was like, I will never forget that because I thought, I have no idea. Like not, "Hey, Katie, how are you doing?" But it was, "We have patients scheduled. When are we going to see you back?" So discrimination at work is real, even for us in the clinical world. And then the sense of urgency too. I still feel the sense of urgency because I feel that my time was cut short, or I had to grow up a lot faster at 41. My kids had to grow up faster. My husband and I had to have conversations. When I had that stroke, I told him, I said, "If I don't remember you in the morning, don't feel bad about divorcing me. I heard that it's cheaper and helps with insurance." I'd heard this years ago. And he's like, "Katie," and I'm like, "Just please, if I don't know you, don't feel that you are obligated to remain with me. I want you to be happy, raise those kids." And how crazy, but we still talk about it. 15 years later, we're the only ones that have had a will from 40 and on because of what we all have experienced. So a reminder, please slow down, smell the roses in between all the craziness. Reflect on your garden soil. All these little blips really continue to make me, ask myself, do I have a healthy, balanced, nutrient-rich garden, or am I in need of some weeding and aerating? Right now, I'm feeling like it's getting healthier, but truthfully, my head has been down, and I have been just in survival mode to get my kids through school. We've had all of our they all have anxiety disorders because mom, had cancer. My 4th grader at the time, she was embarrassed to have her mom pick her up because I was the only mom that was bald. It's been a huge gift to our family. We are super close as a result, a lot of conversation, but as we all know, a lot of struggles that we've all endured also. So stress management, prioritize yourself Tend your garden, especially when you feel it needs the weeding. Stop. Prioritize your family, your co-survivors who have been with you through this journey, and people who have given you care. Redefine your goals. I think this has been a constant in my life, and I don't know if cancer caused me to be this way or if it's just an evolution of getting older. But what do I want to do with my life? What plants do I want in my garden? How do I want my garden to appear? What colors am I feeling this year? What purpose am I feeling? Do the work. More than ever, there are therapists. I know a couple will be talking later today. Take that time for yourself. I really, if that's one piece of advice, I have been deficient in that area, and I need it more than ever now. I mean, I have been through therapy and done some cancer therapy, but cancer survivorship therapy was, again, not a thing in 2010. Now that we have counselors that understand and know how to address some of these issues that are heavy and they're real and they don't just go away. They are with us for life. Utilize those resources, utilize your primary care clinicians. If you have someone who's not listening, find someone else. You do not have to feel bad about shopping for someone who is a good fit for you, whether it's a therapist, a primary care clinician, oncologist, etc. Ask for help. Then finally, positive psychology and social connectedness. This again, too, as I said, I was super busy. I could barely, take care of my appointments, going to chemo, seeing my patients, getting dinner on the table. And I didn't want a lot of help. At the time, like meal train wasn't, a thing. And people asked, can we bring you a meal? And I'm like, oh gosh, no, then my kids will think like something's really wrong, even though something was. And I did not accept help until I was in the hospital, as I said, 6 months later with the stroke, because my husband was struggling. And he said, Katie, please. And I said, okay, I will let, some women in our school community take over. And it was amazing. And what I learned was my kids needed to see that the community was behind us. And I didn't realize that they would not know that at such little, ages. I didn't realize that it would impress upon them that they belonged and they were cared for, even though we had a rich, friend community. Seeing those meals, they would bring the meal to my daughter, my oldest daughter, at the end of the school day, and she'd proudly bring it home for the couple of weeks after, as I was recovering. Positive psychology, I think it's important, but I also want to say, and it'll come up later, positive but not Pollyanna, if that resonates with people or if that's an old fogey analogy. When you look through the world with rose-colored glasses, there's an appropriate rose-colored color, and then there's not. And I think it's okay. I mean, we all have bad days. I don't walk around sending sunshine to everyone's way all the time. But I do feel better when I am feeling positive or can do something for someone else or pay a compliment. And that piece really has reflected on our health and well-being and immune system. So just that reminder, when you're feeling down and you want to isolate, the most important thing is to get out, even though it's like exercise. Even though you don't want to, the moment you exercise, you feel better and you're proud of yourself. The same when you're feeling isolated or down, even if you can get yourself to a coffee shop and just feel other people's energy and pay the barista a compliment, you all of a sudden truly do leave a little bit lighter. And that's what this is referring to, not pretending, but acknowledging that those positive emotions, that positive energy really does play a role in our survivorship. Being engaged, relationships, positive social connections. There was a great talk, I don't know, Liz, you might know, a couple of years ago about finding purpose in your life that a social worker or chaplain did, and it's on the U of M resources. That was so poignant to me because, again, the longer I am in my survivorship, the more I really realize the more I have a purpose or a defined reason for existing, and it changes. It changes on a week to week basis, it changes on a month to month and year to year, but how important that purpose is. And so, again, if you're feeling down, isolated, even if your purpose for that moment is to feed your cat and pet your cat and make your cat feel good, you're living, you're doing something positive. And that's some of these pillars of the positive psychology that are important. And then just a reminder, the longest study that has been done around social connection still is happening. And they took 268 men that had just graduated from Harvard in the 1930s, 40s, and then also 456 men from inner city Boston who were not college grads. And they have followed them for the last almost 100 years. And when they looked, and they keep asking them, how is your happiness? How are you feeling about life? It did not matter how much money they made. It did not matter how many houses, cars, etc. Their happiness boiled down to how strong were their friendships and their social connectedness. And I think we forget about that. As I said too, I was not great about finding a support group. I head down, I needed to get through my stuff. After that stroke, I said to my husband, I think I need to find some people who get what I'm talking about. And I graciously had two patients that were young cancer survivors as well. And they invited me to go with them to a cancer survivor group. I had not laughed that hard in a year. And I was afraid because I thought it was going to be really sad and I didn't need any more sadness or heaviness. And yes, it can be sad. I mean, we're all supporting each other, but it was truly a positive experience. And now I understand why I needed that social connectedness. My girlfriends had no idea what we were going through. And it was not a time where texting was available. It was still the ABC, or it would take forever to form a sentence. And my friends were from the Milwaukee and Chicago area. So our closest friends, they wanted to support us, but they couldn't understand. And then I wouldn't call. I didn't have time to call people back. And it caused a lot of hard feelings during that time. We've worked through it, but to be connected with other people who we could laugh and share experiences like we can at this conference was so therapeutic and cathartic for me. And this is why. And then social media, again, just a reminder, you can find anything you want on social media. Stay with the positives, ignore all the other junk that people put out there. It just, again, it shows the less social media, the higher your happiness. Stick to the positive stuff. Again, that's what these recommendations are. Try to avoid social isolation. The pandemic really, really did a lot negatively for a lot of us. And depression and anxiety are real. Ask for help if you need it. So in closing, I just wanted to say on my initial slide, and then because the conference was called Bloom this year, I love the imagery of the lotus, and I was reading a whole bunch about it in these past couple of weeks, and it just so, the imagery for me as a cancer survivor, this really resonates with me, and I just wanted to end with it. The lotus begins in heavy mud. It has a complicated root system, and it pushes through murky water before it finally blooms and reaches sunlight. And the reason it's used in many wellness images is it emerges without mud, muck, or debris. The ultimate symbol of purity, transcending life's challenges. And that's us. We have our scars, we have our wounds, we have our stories, but we continue to reach toward the light despite the complicated roots underneath in the murkier, darker days. And I love too, it submerges to rest at night in the dark and reawakens to open in the light during its blooming cycle. And this will continue. There are days, like I said, I rest. I totally submerge and hibernate, especially in the winter months. And then as it becomes spring, I'm that first person that, I'm back and I feel myself reaching and stretching to the sunlight. But as survivors, this truly is what we do. And it reminded us, or reminded me of our own potential to grow, bloom, and evolve, new and improved. In closing, gardens are not made by singing, "Oh, how beautiful," and sitting in the shade. Remember the pillars of lifestyle medicine. And this is my garden now in today's, this was Christmas time, the pictures of the kids. From the picture of when we were in the middle of treatment and the flowers. I'm a crazy jack of all trades, master of none person. That's why I'm in primary care. But I recently started to make earrings, and I have lotus flower earrings for everyone if you would like to grab a pair. So they'll be over at that table. So thank you very much.